All right, thank you all for joining us today for a virtual lunch and learn. We are meeting today with the Trauma Informed Work Group of Berry County, and they're going to discuss with us the benefits for business and community health when we have this information and awareness in the general public in our community. So today we have Bill Matson and Deb Timmerman. They're going to lead our discussion. They're going to do quick introductions, and then we're going to kind of go around and I will call on people to do a quick introduction and what kind of interested you in this topic. So with that, I will hand it over to Deb.
Excellent. Thanks, Nicole. My name is Bill Matson, and I'm currently, I do a lot of things, but connected to the Trauma Informed Work Group, I'm currently the program director at the Family Support Center here in Berry County. We are the child abuse prevention agency here in Berry County, and we work on prevention of abuse and neglect. Deb?
Hello, everybody. My name is Deb Timmerman. I am an independent consultant working in the world of stress and resilience. And I'm a master trainer for the Michigan ACEs initiative and do a variety of things, stress and resilience related in the county. And I co-chair the committee with Bill.
All right, thank you so much. So I'll go ahead and start calling on people. I did see in the chat, Emily does not have a mic, but she is here from Berry County CMH and oversees the clinical programs, and obviously has a vested interest in trauma-informed care throughout Berry County because of the work that she does. So with that, I am going to call on Tim.
Good afternoon. My name is Tim McMahon. I'm currently the family educator and kinship care coordinator with Family Support Center, retired from the Berry County Trial Court and former therapist for offenders, juvenile age offenders.
Thank you. Next, Jacob.
Hi, everybody. My name is Jacob. I'm with Berry County Community Mental Health. I'm also a member of the Trauma Informed Work Group through the Great Start Collaborative here in Berry County. And then at Mental Health, I'm part of the Family and Children's team, that department there, and I supervise a program called Wraparound.
Wonderful, thank you. Next on my screen is Michelle Slaughter.
Hi, everyone. I am Michelle Slaughter. I work at Community Action under the Education and Children's Services Department. I oversee Head Start, Early Head Start, and our GSRP blends here in Hastings.
Awesome, thank you. Next is Christina.
Hi, my name's Christina Mann. I am the family service advocate for the Hastings Center and Sue Drummond Center for Community Action Agency. I have 78 families, and I work with them establishing goals and with their kids.
Great. Next, I have Jillian.
Hi, I'm Jillian Foster. I'm the Director of Community Engagement at the Berry Community Foundation. In my area is Youth Advisory Council and Leadership Berry County.
Thank you, Jillian. And next is Bonnie.
It took me a minute to get to my unmute button. Sorry about that. I am Bonnie Geddes. I'm President and CEO of the Berry Community Foundation.
Perfect. Thank you, Bonnie. And next I have Rich.
So good afternoon. I'm Rich Timke, Executive Director of Berry County Community Mental Health.
And then Emily, I believe is the name. E. Sidlowski is on my screen next.
Hi, I'm Ellen Mazik-Sidlowski. I work as a school social worker with the Berry Intermediate School District, and I'm currently at Hastings at the middle school and high school.
Wonderful, thank you. And then I have Amanda.
Hi, my name's Amanda Worm. Definitely different area than everyone else here, but I'm the manager at Lake Trust Credit Union here in Hastings. I'm just kind of looking to see what this is all about. We are always looking for opportunities to help out within the community. And I also know we sponsored the Gun Lake Festival, which I believe was for this group.
Awesome. Thanks for joining us. And then last but not least is Brenna.
I'm Brenna Ellison. I am the quality manager over here at Berry County CMH. So very well informed with the trauma and looking forward to just being able to learn about the different areas the community is supporting. I apologize, I'm on the phone.
Oh, no worries at all. Thank you all again for joining us. I think I got everybody with introductions. So with that, we're going to go ahead and hand it over to Deb and Bill.
Thank you,
Well,
Nicole.
thank you all for coming. It's so nice to see a lot of familiar faces. Bill and I have been out in the community a lot lately, talking to some of the folks that are on this call, and it's good to be supported also by fellow members of the committee. This presentation is really geared toward businesses. So Bill and I will kind of take turns here. We have plenty of time for questions and comments. So we'll just get started.
Thanks, Deb. So as Jacob said, Trauma Informed Work Group is a subcommittee of the Great Start Collaborative, which works with children ages 0 to 5 typically. And they saw a need early on that trauma was a big problem, and a big problem for the kids that they served through those programs. And they wanted to have a work group or a committee specifically tasked to helping the community understand what trauma was and how to build resilience in the face of that trauma. The work group began in 2018, and some of you may have remembered the Resilience movie that we sponsored and showed. That was one of the first tasks that we did as a work group. And we really looked at building a conversation about trauma prevention and healing among the community and organizations that help people in the community. In our group, there's always been an email mailing list of somewhere between 40 and 50 agencies and individuals that are interested. Typically from the beginning in 2018, we've had anywhere from 7 to 20 people at the most attend, but it's usually a core of around 12 people that meet once monthly and talk about trauma in the community and how we can help the community understand the trauma and move on to building resilience. So how we're funded. We have a lot of different funding streams. We did receive our first grant from the Berry County Community Foundation, and they were very, very happy to give us money to work on trauma, and we were happy to get it. In addition to that, we wrote a successful grant for the Michigan Health Endowment Fund. And that was a 2-year grant, and we're into our 2nd year already. And the other funding source that we have would be the $4,000 that Amanda talked about from the Gun Lake Winterfest. We were the group that was the recipient of any money raised at that, and we received that. So as you can see, we probably have around close to $60,000 in funding through grants and donations over the last year. And we're using that to put on trainings and to pay for people to go to training on trauma and doing a lot of things in the community. And we'll talk more about that as we go on. the mission and the vision of the trauma-informed work group has recently been kind of edited and formalized in a strategic planning process that we had. The mission of the trauma-informed work group is breaking that intergenerational cycle of childhood trauma and the life-altering effects on citizens' physical, mental wellness. That's the mission. So we want to look at the reduction of incidents of physical, emotional, and sexual abuse in the county, reduction of the harmful effects of the developing child's brains, and we do a specific training on brain science that really digs into that. But once you know the brain science and the developmental science of a person's brain, you can understand how trauma affects kids and families and then the community in general. We're looking to reduce stigma of mental health treatment by encouraging those experiencing trauma to self-refer to support services. And we want to look at a shift in perspective from downstream Band-Aids to upstream root cause prevention. Once again, the community knowing what trauma is, and then maybe doing some upstream work around building a better community that will have less trauma in it. So some of the goals that came out of our strategic planning was divided into 4 different categories: awareness, advocacy, education, and intervention. We want to make sure that at least 75% of the people in Berry County understand what trauma is and how to prevent it, and also how to build resilience for trauma that's already occurred. So that's real heavy in education of the community. We've talked to a lot of parties here in the county already, from the Sheriff's Department to West Michigan Works, the CMH, United Way, Berry County Community Foundation. We've talked to a lot of parties, and we'll continue to do that. And we'll have routine trainings monthly on trauma and its effects. Advocacy, looking at resources, education around ACEs, adverse childhood experiences, around HOPE, which is healthy outcomes from positive experiences, in looking at secondary trauma prevention for those of us that may work with a lot of people that have had trauma in their life, that put some trauma in our life as we're working with them. So looking at that prevention and stress reduction for those that might have secondary trauma. And then intervention, mental wellness practices, and trained trauma therapists are some of the highlights of the strategic plan. Deb?
So in this next section, I'm going to give you a broad brushstroke overview of what adverse childhood experiences are and how trauma affects individuals throughout their lifespan. So in the beginning, when the ACEs study was done, it was published in, I think, 1999. They came out with 10 different areas that they looked at that contributed to the ability for somebody to be physically and mentally well throughout their lifespan. And they found that when things occurred within these 3 categories of abuse, neglect, or household dysfunction, that people had challenges through the lifespan. So how it was scored was, there was this questionnaire, and it simply asked if you're, from the time that you were born till the time that you were 18, did any of these 10 things happen within your household? And if you said yes to that, you got 1 point, and that was what your ACEs score was. I don't mind sharing, mine was 6. But since that time, that study has grown. There's really a whole field of science around it. And now we know that there are additional factors that contribute to toxic stress and in childhood. And those are racism, historical trauma, war and migration, and most recently, the pandemic. Many people studying trauma and trauma's effects, and there's new stuff that comes out literally every day within some of these news feeds. And we try to stay up on the latest that's coming out so that we can share that science with those people that are in our county and working on our team. Whoops, sorry, I got a little bit ahead of myself there. So in the original study, it found that 27% of the people had an issue with substance abuse in childhood, parental divorce and separation, 23%, mental illness, 17%, and so on. So they're very common. They tested this on over 17,000 participants in a relatively vanilla middle class insureds from the Kaiser Permanente insurance, those that were insured by Kaiser Permanente. So we know it's common. We know that it crosses also social economic barriers, and that when there is one adverse childhood experience, there are usually others. So they tend to occur in clusters, and 87% of them occur in relationship with other things that are happening. And an example I gave yesterday at a training I was doing, the question was, how does that happen? Well, if you are experiencing domestic violence, you're likely to also experience divorce. So those things kind of go together and so on. So here are some examples of ACE attributable problems. The studies have shown that those people that have experienced ACEs have a higher incidence of alcoholism and alcohol abuse, chronic obstructive pulmonary disease, so lung disease, heart disease, depression. They use drugs more often, fetal death, intimate partner violence, liver disease, mental health issues, and so on. So for the purposes today, we chose smoking as one of the ACE attributed problems, and we'll show you kind of what that little lifespan looks like, or that trajectory looks like, from when that starts as an ACE and filters out to affecting healthcare dollars, healthcare costs, and so on. So one of the things that we know from these studies is folks that experience ACEs, it affects their brain in such a way that it wires them differently. Often their amygdala, or the warning part of our brain, is hypersensitive, and they're looking for different coping mechanisms to help themselves calm down. So smoking is one of the first things that they pick up. So smoking, vaping in kids, early use of tobacco products, and then that usually, or can typically last longer than a short period of time and affect them all the way throughout their lifespan. So this little snippet here comes from some of the ACEs training that we deliver, and it's a slide on smoking, early smoking initiation, those people that currently smoke, and those people that have COPD. And what this shows here is that the percent of health problems increases as the ACE score increases. So you can see with early smoking, those people that have an ACE score of 0 are maybe 4% likely to start smoking early, whereas those people that have an ACE score of 4 or more, that crops up to around 12%. Same thing follows with current smoking and COPD. So we know that there's a dose-response relationship, and the more that we have issues, the more we look for those things to help us calm, and we get caught up in those habits that can harm our health. So we're going to take a little look at the cost of smoking. I found this cost per state on the psychiatry website at University of Chicago. And here's what it showed. The total cost per smoker over the smoker's lifespan is $1.5 million. health cost per smoker is about $151,000. Income loss per smoker is $231,000. So you can see that right off the bat, if somebody is a smoker, they're a huge financial burden, not only to themselves because they're losing income, but also to the system. And when we think about what else smoking affects, it affects their ability to maybe put food on the table because we may buy cigarettes instead of buying food. It can affect our ability to clothe our family because we're looking at buying cigarettes to calm ourselves first. It can affect housing. It really can affect a lot of things, including all kinds of other things like secondhand smoke in the house and so on and so forth. So all ACEs are kind of like that. They all have a healthcare cost. They all have a personal cost. They all affect other things such as relationships, ability to show up as a parent, ability to hold a job, everything, all affected by one thing that we could correct upstream. So this chart is really interesting and probably my favorite of all of them that I share. This is kind of a pie of things that we track, like alcohol and binge drinking, tobacco use, asthma. So each part of that pie represents the part of that particular incident to what we would call a population attributable risk. So what that means is those people that are in a giant population, like our United States population, a percentage of them are going to do alcohol, a percentage of them are going to use tobacco. And that little ink block that lays over them represents the percentage of that pie that can be attributed to ACEs. So we just talked about smoking. 36.7% of that pie, or the smoking pie, is attributable to ACEs. So if we're in theory able to reduce or shrink the number of people that we have that have adverse childhood experiences, it should affect the amount of tobacco use that happens within our population. So other notables to point out, we hear a lot of things about suicide prevention. 67% of those people with ACEs are responsible for that pie of the suicide. So if we can reduce ACEs, again, we can increase the health of our county residents. We can reduce the number or amount of money that we spend on healthcare costs. We can increase lifespan. We can increase quality of life.
So what are the risks to the individual businesses? We know that individuals with an ACE score of 4 or more ACEs miss an average of 2 weeks a year. And this is not time off. This is time that they just don't show up. We know that they have increased healthcare costs. There are staff shortages, strained team dynamics. They bring that trauma into work with them, increased error and accident rates, and then workers are unable to meet job demands due to the challenges in their life. This can be issues with kids getting to school, transportation, of them getting to work, or it could be problems with their significant others. So one of the things that we need to do is knock down the ACE scores. And if we do that, we'll prevent homelessness, unemployment, incarceration, disability and learning problems, and poverty. The more work we do there, as Deb said, it will shrink the available population to build that pie, and the less problems we'll have in the community. So the pathways to poverty and homelessness, you know, people adapt as they grow in trauma, they adapt to toxic stress. And that adaptation can be around cognition, the way they think about things, attention to details, and behaviors. They may build a set of behaviors that looks at fight or flight. Some people may run away from everything. Some people may fight everything. So those adaptations really set them up for being a success or a failure in the community. As the community understands what trauma is, they can understand those adaptations. They can understand that somebody is looking for help, but they're fighting it. So where does that come from? Does that come from their trauma background? You know, some of the risks that people face are academic failure, early substance use or abuse, getting kicked out of their living arrangement, dropping out of school, or other adult adversities with law enforcement or other issues in the community where they're shunned by the community or maybe blacklisted by the community. Those are all risks that people who are deemed to be different would run into. In productivity, since they have all these adaptations and maybe not reliable transportation, they're sick some of the times, maybe all they can get is a low-wage job. They have injuries or illnesses at work, disabilities, chronic health problems. I have a family member that always does good at getting a job. But unfortunately, she doesn't hold it for more than 1 or 2 days. And then the adaptations and the way she grew up in trauma impacts her ability to keep her job. So it's something, the more the community knows about it, the more we can react appropriately to somebody who has trauma in their life and help them adapt, maybe make some other adaptations that will bring them back into the community. The Hope Prevention framework is built on 4 building blocks. And the first one you can see up there is safe spaces. That's home, schools, and communities. So that would include safe spaces such as Johnny's gas station on Green Street. If the clerks at Johnny's understood trauma, understood resilience building, that could be a safe space for them. Safe spaces are where people feel safe and are treated in a safe manner. Safe, healthy relationships. That's building those relationships with families and those that feel like families and general community members. Safe and healthy relationships. Community engagement is the 3rd building block. And that's being a part of the community and not just living in the community or walking or driving through the community. It's being part of that community. People understand who they are and they allow them to be involved in community happenings. And the final building block is emotional regulation.
So Bill,
Yep.
talk a little bit more about what the Hope Prevention Framework is and why we chose that as the framework we're working with.
Sure. Hope, and I didn't explain this, healthy outcomes through positive experience is another set of research like ACEs was. And Tufts University over on the East Coast uses this framework to help people build resilience. So ACEs looks at deficits. So it looks at what's wrong with you, what have you gone through that is wrong, and this is how it's going to impact you. Hope is the opposite. It looks at positives, it looks at positive experiences, and there's similar correlations between having positive experiences, reducing the effect of ACEs. So it's a kind of a mirrored study, but it goes to the positive side. We have made a switch probably about a year ago from trying to focus on ACEs and the deficit model to go into the HOPE framework, which focuses on positive things that have happened in people's lives. And how do you get involved in the movement? Well, one of the things you could do is attending kind of a follow-up to this. It's a different training, but it's the HOPE 101 training. The next one is at Pure Cedar Creek, 8:30 in the morning. I believe we'll have breakfast there, correct, Deb?
That's correct.
And it's free of charge for community members. You can either look on our Facebook page where the event is posted, or you could scan the QR code here. And Deb, are we going to send out the slide deck to people who attended today?
We absolutely can.
If we can do that, you can scan that QR code and that will take you to the registration page for that training. We also look to schedule ACEs and HOPE training monthly going into the future through the end of June next year. But if you wanted specific training for your agency, and we've done it for Gold Coast doulas, we've done it for West Michigan Works. We'll be meeting with the community mental health staff at one of their all staff meetings. If you want a specific training to learn about ACEs or HOPEs, feel free to contact us, and our contact information will be on the next slide. But if you want to email me at bill@familysupportberry.com, that would be the quickest way to do it. And then we're looking to identify trauma-aware companies and businesses in our directory. So if you receive the training, there would be that indication in our directory that you've gone through the ACEs and the HOPE training, and that your company is trauma aware.
So I'm just going to give a little impromptu talk about what I did yesterday with family, not family support, Family Promise.
Family Promise.
Family Promise has a new director who comes with a lot of experience, but they just hired 2 case managers. Neither of them had trauma experience, and they're serving people who have traumatic issues. So we spent a couple hours yesterday going through the brain science aspect of this. And it was really interesting. Like, you could see the light bulbs go on about certain people within their organization that they've either served or are serving. So it shifted their thinking from exactly what Bill said, what's wrong with that person, to what happened to that person. And now how can we use those positives or the strengths that that person has to help them build forward, instead of focusing on what happened in the past. So it was really an enjoyable experience to sit around. The training is the training, but the real cool things come from people applying that information and talking about already the changes that they'd like to make within their organization right off the bat. So this is probably a good time for questions, if there are any.
Seeing any, and we haven't had any pop up in the chat, but sometimes it takes a second for people to hit their mute buttons when they want to talk, especially if they're on a phone. So I thought that was really interesting. I think there was a lot of good information in that presentation that you just gave. I know personally, as you were talking, I was able to go, okay, that makes sense about this and this and this, but seeing some of those relationships, the way that you laid it out in the charts, paints a really interesting picture of how all of those things are so interconnected. So we will share out the slide deck and the information on the other event that they're hosting. We will also send out the recording of this presentation to everyone that registered. I think we had some people that probably weren't able to join because they're doing the United Way's Day of Caring activities today. So we'll make sure to get this information out. And again, if anybody would like to connect with Deb or Bill, we'll send that information along as well. You can also email me and I can connect you that way too. So if we don't have any more questions, do you have anything else that you want to add?
No, thank you though, Nicole.
Thanks.
Awesome. Well, I'm gonna stop the recording.